Good morning, and thanks for attending. Today I'm joined by Louise Gagne, Executive Director of Community Services, to give an update on our local COVID-19 situation, and Andrea McClellan, Director of COVID-19 Immunization Strategy, will provide an update on vaccinations. But before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. With the upcoming federal election on Monday, we recognize the importance of researching and prioritizing platforms that highlight issues impacting Indigenous peoples and communities, such as reconciliation and implementing the Truth and Reconciliation Commission's calls to action, and recognizing treaty, Indigenous rights, and self-determination sovereignty. Throughout our district, the number of people testing positive for COVID-19 is increasing. Although an increase was expected, at this time, we aren't able to determine a specific trend. Therefore, I ask that before going out, you continue to consider the risks, including the location, who will be there, and if the individuals are vaccinated. On Tuesday, the province shared more information on the COVID-19 vaccination certificate program. As I've stated previously, I am in support of the certificate program. The program targets non-essential locations throughout the province that are at high risk of spreading the virus. As of next Wednesday, September 22nd, individuals will need to provide proof of vaccination in certain settings, including but not limited to indoor dining in restaurants, indoor areas of facilities used for sports and recreational fitness activities, indoor areas of concert venues, theaters and cinemas, indoor areas of meeting and event spaces, and indoor areas of casinos, bingo halls, and other gaming establishments. As we move to the vaccine certificate program, the health unit is here to help answer your questions, provide vaccinations, download your vaccine certificate, and if you don't have access to a computer or internet, print your certificate for you. Furthermore, as of October 22nd, the province will be launching a QR code system for establishments to monitor vaccination status more easily. Once available for download, we will continue to support the people in our district to navigate this change. Finally, the province has also announced they're expanding the eligible group for a third dose of the COVID-19 vaccine, for which Andrea will provide an update shortly. But first, we'll go to Louise Gagne, who will provide us with an update on the current COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we have had 19 cases, bringing our total case count to 730, with 509 in the Nipissing district and 221 in the district of Parry Sound. The health unit currently has 22 active cases, with no individuals in hospital due to COVID-19. There are currently no active cases that have tested positive for a VOC, but are presumed to be the Delta variant, as 99.3% of the cases in Ontario are the Delta variant. Some cases that we have are still awaiting further testing. Since June 1st, 67% of individuals eligible for the vaccine who tested positive for COVID-19 were unvaccinated, while 24% were partially vaccinated. 9% of cases have been identified as breakthrough cases. Breakthrough cases mean individuals who have tested positive for COVID-19 but were also considered fully vaccinated. Furthermore, 29 cases were born in 2009 or later and are not yet able to be vaccinated. Since the beginning of the school year, there have been 5 cases in school and childcare settings. However, no outbreaks have been declared. For this new school year, we will not disseminate a public service announcement for single cases in school and childcare. Each school board reports school cases of COVID-19 on their website, and high-risk close contacts are contacted directly by public health staff. In addition, the immediate school community, including parents and guardians, are notified directly by the school and school board of the case. We will continue to disseminate a news release for outbreaks in schools and childcare settings to the public, or in instances where information needs to be shared to the general public in a timely manner. An example of this was the news release we disseminated this past Sunday, advising of a potential exposure to COVID-19 on 2 local bus routes. This release was shared in an abundance of caution to ensure all potential low-risk contacts were made aware in a timely manner. Lastly, I want to share that the Health Unit has launched a new workplace vaccination policy toolkit, an education module for businesses. We recognize that having a workplace vaccination policy is an important measure to promote the safety of employees and the public. We strongly recommend that every workplace develop and implement such a policy. To access these resources, visit our website, www.myhealthunit.ca/vaccine policy. Once you're on that page, select Workplace Vaccination Policies. Now back to you, Dr. Chirico.
Thank you very much, Louise, and we'll turn it over to Andrea to give us a vaccine rollout update.
Thanks, Dr. Chirico. Good morning, everyone. As of 3 p.m. yesterday, we are now at 82.9% of residents 12 years of age and older who have received at least 1 dose of a COVID vaccine, and 76.2% of residents 12 years of age and older who are fully vaccinated. Additionally, 76% of youth 12 to 17 years of age have received at least 1 dose of COVID vaccine, and 62% have received both doses. As of yesterday at 3 p.m., a total of 181,251,000 vaccines have been administered in our district. As mentioned by Dr. Chirico in his opening remarks, the province has expanded the list of eligible individuals who can receive a 3rd dose of COVID-19 vaccine. As of Tuesday, the following individuals are now eligible for 3rd doses: those undergoing active treatment for solid tumors, those who are in receipt of chimeric antigen therapy, CAR-T cell therapy, those with moderate or severe primary immunodeficiencies, stage 3 or advanced untreated HIV infection, and those with acquired immune deficiency syndrome, and those undergoing active treatment with the following categories of immunosuppressive therapies, including anti-B cell therapies, high-dose systemic corticosteroids, alkylating agents, antimetabolites, or tumor necrosis factor inhibitors, and other biological agents that are significantly immunosuppressive. The province recommends an interval between the 2nd and 3rd dose of at least 8 weeks. Immunocompromised individuals with one of these eligible conditions will be contacted can contact their healthcare provider to confirm their eligibility, and will be provided with a referral form to receive a 3rd dose. They just need to bring that 3rd dose to one of our clinics, or sorry, that 3rd form for the 3rd dose. We continue to see a great recent uptake in vaccinations. In fact, we've administered over 1,743 doses over the past 7 days, including 658 first doses, 696 second doses, and 389 third doses. We continue to drive around the district with our Big Blue bus to hold mobile clinics, and we are adding more vaccine clinics as needed. On this past weekend, we were in Callander, Astorville, and Corbeil, and provided a total of 139 vaccines, 64 first doses, 69 second doses, and 6 third doses. Yesterday at our Northgate Square Clinic, mobile clinic, we immunized a total of 302 individuals, 114 for first doses, 173 second doses, and 15 third doses. For the remainder of this week, the bus will be out providing clinics in Seguin Township today, Trout Creek and South River tomorrow, Mattawa and Bonfield on Saturday, and the North Bay Waterfront on Sunday. In terms of vaccination rates for the COVID-19 vaccine in our area, we are in line with the Northern Ontario Health Unit coverage rates. The target remains to achieve 90% vaccination rates for both first and second doses. In order to achieve this, we need to administer 8,195 additional doses of first additional first doses and second doses, as well as those who have already received a first dose. A further 7,759 second doses are required for us to achieve that 90%. And now I'll turn it back over to Dr. Chirico.
Thank you very much, Andrea. And so that ends our remarks, and we'll be happy to take questions and get to as many as possible. Enter them into the left of your screen, and please associate your name with them if possible. And we'll turn it over to Catherine for the first question.
Thank you. The first question is for Dr. Chirico, comes from Clark at Cogeco News. Does the health unit have the ability to intercede on health protocol decisions made by the school boards?
Yeah, the answer to that is yes. We do have the ability through the Health Protection Promotion Act. Medical Officer of Health certainly can, if we feel that there is a risk to the public, we have the ability to put in safeguards to safeguard, obviously, the health of individuals. So we do have that ability, but we work with the school boards, and we're very supportive of decisions that they have made. And we feel that it's important that we work together, and our primary focus is keeping students safe.
Thank you. Our next question will be for Andrea from Richard Coffin at My North Bay Now. With more third dose groups added, is it expected that the rest of the population age 12 and up will follow at some point?
You are muted, Andrea.
My apologies. Expect the rest of the population. The rest of the the 12 and up are already eligible for immunization. It's the 5 to 11-year-olds who are not currently eligible for immunization. And we're anticipating some form of an announcement with regards to 5 to 11-year-olds sometime in the late fall, early winter timeframe.
I think the question was pertaining more to the third doses. And at this time, the rest of the general population, the evidence isn't there to suggest that they need a third dose. That may follow, but we have to, it'll be based on the recommendations from certainly the Science Table and the National Advisory Committee on Immunization as to whether or not third doses are necessary. Certainly for those that are immunocompromised, the ones that they've listed, they feel that this is the best protection would be completing a series with the third dose, because their immune systems don't always respond as well as normal, healthy immune systems.
Thanks, Dr. Chirico. My apologies for misunderstanding the question.
No problem.
Our next question is for Dr. Chirico, and it comes from Eric Tashner at CTV News. Last night, PPC candidate Greg Galanti tweeted about systemic and program stigmatization of a certain segment of society and compared the current public health restrictions on the unvaccinated to the horrors of the Holocaust. What does the health unit respond to these claims?
Well, my response to that is that I think people recognize a statement like that for what it is: absurd.
Our next question would be for Louise and comes from Sarah Bissonette at the North Star. The Parry Sound Public School had 2 cohorts dismissed with 2 cases of COVID. Testing was done. In how many days can the health unit and community be assured there was no spread amongst the cohort?
Thanks for that question. All our high-risk close contacts are asked to isolate for 10 days following an exposure. So if we see those high-risk exposures after 10 days and they have no symptoms and they've tested negative, it's safe to assume that there has been no transmission. Dr. Chirico, is there anything you'd like to add with respect to that?
No, that really sums it up.
Thank you. Our next question is for Andrea from Sarah Bissonette again from the North Star. There was a vaccine clinic in Parrystown High School this week. Do you have the number of people who received a dose?
Sure, I can provide that for you, Sarah. Thank you. There were 44 vaccines given. 28 were first dose and 16 were second doses of COVID vaccine.
Thank you. Our next question comes from Sarah Bissonette again from the North Star, and would be for Louise and perhaps Dr. Chirico as well. What is the most common questions concern the health unit is hearing from local businesses ahead of the COVID passport?
So we haven't heard a great deal yet with the news coming out just recently. We haven't heard a great deal yet from the business community on what their specific concerns are. It will likely be how do they implement this and what are the expectations from an enforcement perspective.
Yeah, I would agree that most of the concerns are the logistics of implementing it and really how is it going to be enforced and by whom. And I think that I want to certainly begin by saying that the approach that we are going to be taking and that the province is taking is more of a progressive education approach. Nobody wants to harm businesses any more than the pandemic has, and we want to work with businesses to help ensure that they are compliant. And so we will work with them. We will have an education certainly component to it and try to help answer any questions that they have.
Thank you. The next question is for Andrea. It comes from PJ from the Nugget. How many doses of the vaccine have been administered at North Bay area high school so far?
Thanks for that question, PJ. I don't have that information right off the top of my head, but I will have it to you today.
And PJ just followed up to this previous question asking how many more clinics are planned at local high schools.
Sure, that's a great question. We actually have.
You're on mute, Andrea.
Sorry, I'm having a hard time this morning. We have clinics running the remainder of this week, next week, and into the beginning of the third week. So we'll be attending all schools that have children registered at their schools that are 12 years of age and up.
Thank you. That was our last question. Thank you everyone for submitting your questions. The recording of the press conference will be posted on our website later on today. We will see everyone next week.